So stage 0 breast cancer, which is technically known as Ductal Carcinoma In Situ, or DCIS, is a really interesting clinical kind of dilemma these days. So it's a precancer, technically. It's something that may turn into invasive breast cancer, and invasive breast cancer is the kind of breast cancer that has the potential to not only grow in your breast, but to spread other places in the body and ultimately hurt someone more than just, needing a breast surgery. But DCIS, or that stage 0 breast cancer, is in and of itself not necessarily going to turn into that invasive breast cancer. And so many have questioned, well, do we actually really need to do surgery on something that may or may not turn into a problem? Given that, we've actually started planning and are running trials. The one in the US is called the COMET trial, and there are complementary trials elsewhere in the world that are looking at lower risk DCIS and saying, you know what, if you're willing as a patient and game to be part of this research, we're going to put you on this study, and the computer is going to help decide whether you get randomized to getting standard treatment, which generally entails surgery with or without radiation, and people could take hormones too to lower the risk of the DCIS ever turning into anything, or to an arm that is called active surveillance, or a watch and wait approach, and see whether or not the mammogram changes. And if the mammogram doesn't change, or if it changes for the better, then watching makes sense. When I talk to women about that, I go through all the pros and the cons of either arm, but I think if a woman is seeing a physician who says you need surgery, I think it's really important that she maybe get a little more information. You can go online, you can talk, get a second opinion, and then come back to the doctor and say, hey, I read about this. Would this be a good fit for my cancer and my treatment? And I think that any doctor worth their salt should be able to address those kinds of questions and help patients to feel really confident about the decisions they're making in their care in general. So we need to be able to do that. We need to empower patients to feel very comfortable asking the what about this question.